Rheumatoid arthritis is a condition that has plagued the human race for centuries, yet there have been some recent breakthroughs in treatment. So here to tell us more is Dr. Robert Goodman of the Arthritis and Rheumatology Clinic in Shreveport. So doctor, thank you so much for joining us today.
Glad to be here.
Let's talk a little bit about rheumatoid arthritis, because I think sometimes people forget there are multiple kinds of arthritis.
Really, there's about 100 types of arthritis, and rheumatoid arthritis is one of the more important ones because it is an autoimmune disease in which the immune system makes a mistake and attacks the inner lining of the joints. The name of the inner lining of the joints is called the synovium, and when rheumatoid arthritis causes inflammation there, it is called a synovitis. If left unchecked, it can damage the joints of the hands and feet.
So how do you know if you have arthritis, if you're having a flare-up or versus just a regular ailment of soreness?
Well, if it's been lasting longer than 3 months and if it's causing significant observable swelling and inflammation in the small joints of the hands, that would be a clue that you could have rheumatoid arthritis. Probably need to see your doctor and maybe end up seeing a rheumatologist.
Let's talk a little bit about treatment for somebody who may be needing it.
Well, the treatment, we're sort of in a golden age of treating rheumatoid arthritis. In the past, we had medications that were oral medications that were available in the 1990s, medications such as methotrexate and hydroxychloroquine, but more recently, there have been dramatic breakthroughs in treating rheumatoid arthritis. These biological medications can specifically target the immune system so that we can better treat the patient and really without limiting side effects. Some of those biologics you see advertised on TV, Enbrel and Humira, but there are lots of new biologics that can really help patients these days.
That's wonderful news. Is there any signs of being predisposed to rheumatoid arthritis that people should be on the lookout for?
Well, rheumatoid arthritis tends to occur more if you have a family member with rheumatoid arthritis. The incidence of rheumatoid arthritis in the general population is about 1%, but if you have a family member, it might go up to 8%, or about 1 person in 12, and women tend to get rheumatoid arthritis more than men.
Okay, so what I have learned today is that you're telling me I don't have to be miserable if you receive the diagnosis of rheumatoid arthritis.
No, you really don't. With these new breakthroughs, rheumatologists can really take the disease control to the next level so that we can preserve joints and return people to full or nearly full function.
That's wonderful news. Well, doctor, thank you so much for joining us today. We've learned a lot.
Glad to be here.
All right, everyone, we've got some information up on your screen. So if you'd like to learn more about the new treatments for rheumatoid arthritis, you can check out the clinic's website at arthdoc.com or on their Facebook page.